Good afternoon, everybody, and a happy World Environment Day. Uh, did you know that decomposing a single non-degradable sanitary napkin can take up to 500 years? This fact underscores that these products' long-lasting impact on our environment, as materials used such as plastic never truly biodegrade, causing significant harm to our planet. Today, as we come together on World Environment Day, it is crucial to address pressing issues affecting our planet and well being. One such concern is the environmental impact of non degradable sanitary napkins. My name is Ria, and I work at Population Foundation of India as the Associate Lead Youth and Adolescents. On behalf of Action Research and Training for Health and Population Foundation of India, I warmly welcome you all to this webinar on sustainable menstrual hygiene options. Here we have gathered experts, advocates, and change makers who are dedicated to finding innovative solutions to this critical issue. Throughout the next 1.5 hours, we will explore sustainable practices, eco friendly alternatives, and community driven approaches that empower individuals to access safe, affordable, and sustainable menstrual hygiene options. On a logistical note, we are recording this webinar, and I may also request all participants to park their questions in the Q&A section as we have a dedicated session for the same. Once again, thank you for joining us today. Let us dive into this discussion without any further delay. May I request Ms. Poonam Mutreja to deliver the opening address? Ms. Mutreja, Executive Director of Population Foundation of India, has for over 40 years been a strong advocate for women's health, reproductive and sexual rights, and rural livelihoods. She has co-conceived the popular transmedia initiative मैं कुछ भी कर सकती हूँ, I, a woman, can achieve anything. Before joining Population Foundation
Thank
of
you.
India, she served as the India Country Director of the John D. and Catherine MacArthur Foundation for 15 years and has co-founded and led the Ashoka Foundation Dastakar and the Society for Rural, Urban and Tribal Initiative. Poonam is a member of the Governing Council and Board of Action Aid International and India and is a member of a committee at the National Academics for Sciences, Engineering and Medicine, Washington, D.C. An alumni of Delhi University and Harvard University John F. Kennedy School of Government, Poonam serves on the governing council of several.
Thanks. Thanks.
Okay.
I'm going to, everybody knows
Yes.
much about me, so let's save time. Sorry to interrupt you. Go ahead.
No, no.
You were just
So I
inviting
welcome.
me, right?
Yes, yes, I invite
Okay, great. Thank you so much, Ria, for setting the tone. It is it's absolutely fortunate that we are decided to do this webinar on sustainable menstrual hygiene options on World Environment Day. And I would like to quickly highlight a few points, and one of them being that introduction of recyclable, sustainable sanitary alternatives like reusable tampons, menstrual cups, period panties, reusable sanitary pads can help reduce plastic waste and its environmental impact. So today is a good day to look at the intersection of environment and young people, women's health issues, girls and women's health issues. For proper waste management, we need to tackle some of the challenges generated by disposable or traditional products. And in addition, I'd like to say that India accounts for production of 113,000 tons of menstrual waste annually. This is as per the WHO data. We'll be hearing more from Sharad when he presents the study that he is going to do in a few minutes. And challenging the stigma is another challenge, apart from sustainability. In India, menstruation accelerates social barriers for women and adolescents. Much of these barriers stem out of taboos, myths, misconceptions, discrimination discriminatory traditions such as even ostracization of women and adolescent girls during periods, as well as considering them impure during periods. So that's another challenge of stigma that goes, I would like to highlight as a second issue. And the final one is access and availability. Even today, 23 million adolescent girls in India drop out of school due to the lack of facilities, or should we say proper menstrual hygienic management facilities. Greater attention is indeed required for adolescents' health through the very many health programs like the RKSK, Rashtriya Kishori Swasthya Karyakram, menstrual hygiene schemes to promote menstrual hygiene amongst adolescents in rural India. We made huge progress. I remember 25 years ago when MacArthur Foundation gave a fellowship to Vanita Mukherjee, who's here in this webinar. There was no public conversation about menstrual health. Today, at least menstrual health is much on the agenda, and it's time we started to work on sustainability. And NFH has 5 states that 78% of women in India use a hygienic method of menstrual protection that includes locally prepared sanitary napkins, tampons, menstrual cups, and sustainable options can indeed bridge this gap and offer not only accessible but affordable and comfortable, reusable solutions in the long run. So by promoting local production and distribution of sustainable products, India can improve access to menstrual hygiene. Sorry, I'm at an airport, so the sound. I'll quickly, okay. Now, the next I want to talk a bit about cost effectiveness and affordability. A Lancet study revealed that purchase costs of costs and waste from consistent use of menstrual cup, which is the vaginal cup, could be a small fraction of the purchase costs and waste of pads or tampons for that matter. So while the upfront cost may be higher to begin with, production of menstrual cups or reusable cloth pads, their reusability over an extended period makes them more economical compared to constantly purchasing disposable products, and especially it'll benefit those individuals from low-income backgrounds who may struggle to afford disposable menstrual products. Is this disturbing a lot, Ria? The background? No,
No,
it's
it's
okay.
fine. Yeah.
Should I continue? Okay.
Yes.
So empowerment and education, the level of education also plays an important role in the access to menstrual hygiene methods, whereas 80% with girls or women with no schooling have been said to be using cloths during their menstruation cycles, and as opposed to 90% women with 12 or more years of schooling making use of at least one hygienic method in India. So empowering individuals with knowledge and access to sustainable products allows women and adolescents to make informed choices, take control of their menstrual health, and break the stigma surrounding menstruation. And we will be hearing, as I said, more from other colleagues, but now it's my privilege to welcome you, Dr. Sowmya Swaminathan, who I will refer to as Sowmya, if I may, Sowmya. She's a distinguished medical professional and a leading figure in global health, has had a remarkable career spanning several decades. She has made significant contributions, doesn't need introduction, but I will only say everybody knows Sowmya, who we saw regularly also speak to us during COVID as the chief scientist at the World Health Organization and Director General of Programs. She's been Director General of Programs and has guided research and development initiatives to address pressing health challenges. Her expertise lies in infectious diseases and global health, focusing on tuberculosis, HIV/AIDS, and health policy making, and her research, capacity building, and fostering partnerships. I do want to, right now, after coming back from WHO, Sowmya is the chairperson of the renowned MS Swaminathan Research Foundation set up by Dr. MS Swaminathan. And she continues to shape evidence-based strategies for disease control and global healthcare improvement. Today's Sowmya works at the intersection of health and sustainable development, which is what many of us in the future want to, in India will be a huge guiding force. And I do want to share that Sowmya has a lot of passion and commitment about working on menstrual hygiene. And as she came on our board just a few months ago, we have the proud privilege of having Sowmya on our board. And I committed to her, one of the things we will work on is menstrual health management, and especially menstrual cups. So welcome, Sowmya, and we are very lucky to have you. Over to Sowmya will be releasing the report and speaking to us. So Ria, I'll hand it over to you, but yeah.
Yeah, so ma'am, we would be now sharing the screen, and we request you to kindly click the release button to launch the report. So
and then
colleagues. Yes.
Sowmya, can we now invite? Oh.
Thank you so much. Ma'am, now can we request you and invite you to share some critical insights and remarks?
Yes, thank you so much. And thank you very much, Poonam, for that introduction. And I'm very happy actually to be at this function discussing this particular topic because of a couple of things. अभी पिछले कुछ महीनों में मुझे भारत के अंदर कई जगह मैं विजिट कर रही थी, तो मैं जहाँ भी जाती हूँ, स्पेशली अगर मैं गांव में जाती हूँ या महिलाओं से बात कर रही होती हूँ, तो उनसे मैं जरूर कुछ सवाल पूछती हूँ और यूजुअली मेंस्ट्रुअल हाइजीन के बारे में मैं पता करती हूँ। तो मैं उड़ीसा के ट्राइबल एरिया में थी, कोरापुट डिस्ट्रिक्ट में, और वहाँ पे मैंने जब महिलाओं के साथ बैठ के बात किया, बहुत सारे विषय पे हम लोग चर्चा कर रहे थे, तो उसमें मैंने उनसे पूछा कि आप लोग क्या करते हो मेंस्ट्रुअल पीरियड के लिए, और बेचारी यहाँ वहाँ देखने लगी, बट फिर पता लगा कि वो कपड़ा ही यूज कर रही हैं पुराने तरीके का, क्योंकि उनको सैनिटरी नैपकिन की भी एक्सेस नहीं थी। और हमें पता है कि जो लड़कियां स्कूल जा रही हैं, कम से कम उनको स्कूल में सैनिटरी नैपकिन ज्यादातर मिल जाती हैं, पर जैसे ही लड़की स्कूल छोड़ देती है तो उसको फिर वो सुविधा नहीं मिल पाती है, और फिर वो वापस अगर गरीब हो तो फिर कपड़ा ही इस्तेमाल करते हैं। दूसरा एक्सपीरियंस मेरा रहा जहां मैं केरला में वायनाड डिस्ट्रिक्ट गई थी, जहां पर स्वामीनाथन का दोनों जगह उड़ीसा में भी और केरला में भी हम लोग काम करते हैं, दोनों ही ट्राइबल डिस्ट्रिक्ट हैं। तो जब मैं वहां गई तो वहां पे पंचायत प्रेसिडेंट से मेरी मुलाकात हुई और उन्होंने बताया कि वो कार्बन न्यूट्रल पंचायत की काम कर रहे हैं, कि उसका उन्होंने गोल बनाया है और उसमें एक जो उनका प्लान ऑफ एक्शन था, आइडिया था, वो था यूज ऑफ मेंस्ट्रुअल कप। तो आई वाज वेरी इम्प्रेस्ड कि एक पंचायत प्रेसिडेंट, वो भी एक आदमी, उन्होंने ये मेंस्ट्रुअल कप्स को वहां पर पॉपुलराइज करने के लिए और कार्बन न्यूट्रल प्रोग्राम के अंदर उन्होंने ये आइडिया सोचा और बताया। आई वाज वेरी जेन्युइनली इम्प्रेस्ड एंड आई हैड अ कॉन्वर्सेशन विद हिम। फिर उन्होंने मुझे आगे और भी कुछ बातें बताई। उसमें एक तो ये था कि जो युवा हैं, जवान लड़कियां हैं, उनको कोई प्रॉब्लम नहीं एक्सेप्ट करने में मेंस्ट्रुअल कप, बट उनके जो माँ बाप हैं वो थोड़ा रेजिस्टेंट थे और उनके इसमें कई मिथ्स हैं। कई मिथ्स को क्या कहते हैं हिंदी में, ऐसी
भ्रांतियां।
हाँ, भ्रांतियां जो लोग सही बात नहीं है, वो गलत चीज है, पर वो बहुत सालों से उनके मन में, जैसे वर्जिनिटी और यूज ऑफ मेंस्ट्रुअल कप्स का जो रिलेशनशिप है, ऐसे गलत फहमियों के वजह से माँ बाप नहीं अलाउ कर रहे थे। जहां तक लड़कियां जो थी वो काफी उसमें इंटरेस्टेड थी। तो मैंने उसी समय पूनम से बात किया और मैंने कहा कि इस विषय में आप लोगों ने कुछ काम किया है क्या, क्या जानते हैं आप, क्यों ना हम इसको और सीरियसली लें, क्योंकि ये जो परेशानी है, आफ्टर ऑल हाफ ऑफ द इंडियाज पॉपुलेशन, हाफ ऑफ द वर्ल्ड पॉपुलेशन आर वुमेन एंड वी फेस दिस इशू, जहाँ एक तरफ एक्सेस ही नहीं है कोई मेंस्ट्रुअल हाइजीन प्रोडक्ट की, और दूसरी तरफ जहाँ पे एक्सेस है वहाँ पे ज्यादातर सैनिटरी नैपकिन यूज करते हैं लोग, जिसमें अब हमने सुना और अभी हम देखेंगे रिपोर्ट अभी जो रिलीज हुई है, उसमें स्टेटिस्टिक्स दिए गए हैं कि मेंस्ट्रुअल जो सैनिटरी नैपकिन है उसमें पॉलिएस्टर यूज होता है, उसमें नॉन बायोडिग्रेडेबल है, 500 साल लगते हैं डिग्रेड होने में, और जो वॉल्यूम हम क्रिएट कर रहे हैं, जितनी महिलाएं हैं भारत में और बाहर भी, तो ये हम प्लास्टिक पोल्यूशन को बढ़ा रहे हैं एक तरह से। इसको सेफली डिस्पोज करने के लिए कुछ फैसिलिटीज की जरूरत पड़ती है, जैसे इंसिनरेटर या मतलब अगर बेरी करना हो तो कुछ तरीके से करना होता है, उसके कोई स्टैंडर्ड होता है। तो अगर उसको हम ना फॉलो करें, ज्यादातर जो शहर है वो इसका कोई स्पेशल अरेंजमेंट नहीं किया उन्होंने, एक या दो शहर ऐसे हैं जिन्होंने मेंस्ट्रुअल प्रोडक्ट के लिए अरेंजमेंट किए हैं। तो अगर ठीक तरह से इंसिनरेटर ना यूज करें, जैसे छोटे साइज का इंसिनरेटर जो टॉयलेट के अंदर रखा जाता है, इससे और बहुत पोल्यूशन बनता है और वो बिल्कुल हेल्थ के लिए अच्छा नहीं है। तो ये सब चीजें देखते हुए डेफिनेटली मेंस्ट्रुअल कप के जो एडवांटेजेस हैं वो हाइजीनिक भी है, तो विमेन्स हेल्थ के लिए भी अच्छा है, और रिलेटिवली इजी टू यूज है, एक्सेप्टेबिलिटी भी ठीक है, वो भी हमने स्टडी में देखा, और एनवायरनमेंट के लिए अच्छा है क्योंकि रीयूजेबल है, इट इज मेड ऑफ सिलिकॉन एंड वो माइक्रोप्लास्टिक्स नहीं क्रिएट करता है, तो बहुत साल तक रीयूज हो सकता है। एक चीज है कि उसमें उसकी जो मैन्युफैक्चर है कि स्टैंडर्ड अभी कोई ग्लोबल या नेशनल स्टैंडर्ड नहीं है, तो उसकी कमी है और हमें उसके ऊपर थोड़ा ध्यान देना चाहिए। बट मुझे बहुत खुशी हुई जब पूनम ने और पीएफआई ने मुझे अप्रोच किया कि हम अर्थ के साथ मिलकर ये रिपोर्ट लॉन्च कर रहे हैं वर्ल्ड एनवायरनमेंट डे के ऊपर, और मैंने कहा जरूर मैं इसमें शामिल होंगी, क्योंकि इसके बारे में मैं कई दिनों से सोच रही हूँ और मुझे बहुत एक लगता है कि हम एक अर्जेंट तौर पे इस इशू को की ओर ध्यान दें और इसके लिए कोई सोल्यूशन लेकर आए, क्योंकि हमारी जो बहनें हैं बहुत सारी, उनके पास कोई ऐसे हाइजीनिक तरीका नहीं है और अभी वो कपड़ा यूज कर रहे हैं, तो ज्यादा अगर उनको हम सैनिटरी नैपकिन इंट्रोड्यूस करें दोबारा शिफ्ट करें, उससे अच्छा तो यही है कि एक जिसको कहते हैं एक लीप ऑफ टेक्नोलॉजी, तो क्यों वो पोल्यूटिंग टेक्नोलॉजी यूज करें जब एक एनवायरमेंटली सस्टेनेबल और नॉन पोल्यूटिंग मेथड है हमारे पास। तो सीधा ही हम कपड़े से, विच इज अ नॉन हाइजीनिक प्रैक्टिस, एक मेंस्ट्रुअल कप को क्यों ना करें। इसके लिए क्या चाहिए होगा, इसके लिए थोड़ा हमें काम करना होगा। एनजीओ को हम सब साथ मिलकर अगर करें, गवर्नमेंट के साथ भी मिलकर, डिपार्टमेंट ऑफ WCD के साथ, ताकि स्कूलों में भी इंट्रोड्यूस हो, जहां भी फ्री पैड मिल रही हैं, सैनिटरी नैपकिन, वहां पे menstrual cups दे दिया जाए। And I'm sure if we do the economics, in the long term, this is going to turn out to be economically, I think, very viable proposition, क्योंकि it's a one time investment। चाहे को ऐसे महंगा हो शुरू में, बट उसका जो लाइफ जो है वो बहुत लंबा है। तो इसमें थोड़ा इकोनॉमिक एनालिसिस भी करके हम गवर्नमेंट को दें तो ज्यादा अच्छा रहेगा, कि अगर वन टाइम इन्वेस्टमेंट इतना हो तो 3 साल बाद, 4 साल बाद, 5 साल बाद क्या रिटर्न इसमें मिलेंगी इकोनॉमिक वहां से देखें तो। और दूसरा, ऑफ कोर्स, एनवायरमेंटली इट हैज लॉट ऑफ बेनिफिट। और तीसरा जो है, हमें कम्युनिटीज के साथ मिलकर काम करना चाहिए, क्योंकि अल्टीमेटली एक्सेप्टेंस की भी बात है। तो जैसे हम अब ये स्टडी देख रहे हैं, अर्थ ने जो किया है उसमें क्या फिजिबिलिटी थी, उसके नंबर्स आर मॉडेस्ट। तो अभी हमें और जगह में लेके जाना चाहिए, और एनजीओ के साथ मिलके, ताकि हम रूरल एरियाज में, अर्बन एरियाज में, डिफरेंट एज ग्रुप्स में इसको टेस्ट करके इसकी फिजिबिलिटी और एक्सेप्टेबिलिटी देखें। और मेरे ख्याल जहाँ पे पंचायत अवेयर है, और जहाँ पर भी पंचायत क्लाइमेट चेंज के ऊपर और एनवायरमेंटली चैलेंजेस के ऊपर काम करना चाहती हैं, those will be the right places actually to go in. And I think it can also serve as perhaps economic livelihood opportunities for women, self-help groups. Though this is not a product which you make at home, sanitary napkins तो घर में औरतें चीज बना रही हैं, तो उनके लिए एक लाइवलीहुड ऑप्शन है। बट इसके लिए मेरे ख्याल से फैक्ट्री की जरूरत पड़ती है, बट वो एक्सप्लोर करके देख सकते हैं कि किस तरह से वो प्रोडक्शन फैसिलिटीज को लिंक कर सकते हैं इन विमेन्स ग्रुप्स के साथ, ताकि वो उसको एक इकोनॉमिक अपॉर्चुनिटी भी बन सकता है, लोग बेच सकते हैं, उनकी ट्रेनिंग हो सकती है, वो अपने अपने कम्युनिटीज में इसको पॉपुलराइज कर सकते हैं। तो मुझे लगता है कि कई सारी ऐसे अपॉर्चुनिटीज हैं जिसे एक्सप्लोर किया जा सकता है। तो सबसे पहले मैं अर्थ और PFI को कंग्रेचुलेट करती हूँ कि इस टॉपिक पर इन्होंने इतनी अच्छी तरह से काम किया और रिपोर्ट निकाला, और इसको अब हम सब साथ मिलके आगे ले जा। और मुझे आज के ये अवसर पे इनवाइट करने के लिए बहुत धन्यवाद।
Thank you so much, ma'am. Thank you for sharing these critical insights, especially insights from the lives of the women and girls who belong to the most vulnerable and marginalized populations, their challenges in accessing safe and affordable methods, and the need to especially reach girls who are out of school and girls who are out of institutional cares. Thank you for also highlighting the need to dispel the myths and misconceptions in the community and the need to have a robust social behavior change communication strategy to address these issues, and for suggesting and looking at exploring sustainable options which are more environment friendly, and the much needed requirement of a global and a national standard, especially for the production companies, so that the products are sustainable and safe and there are options available for women. Thank you so much, ma'am, for the insights. I would now like to invite our next speakers to share insights from the report, which compares the environmental cost of menstrual hygiene options and elucidates the use for acceptance of menstrual cups among rural and tribal women in southern Rajasthan. Ms. Gunjan, Research Associate at ARTH, is also a valued member of the Center for Contraception Research. Her work focuses on research activities pertaining to women's health. particularly in the areas of contraception and menstrual hygiene, and includes collaborating with communities to gain insights into diverse aspects of reproductive health. I'm also honored to invite Dr. Sharad, co-founder and chief executive of ARTH, who is a distinguished public health professional and pediatrician with an extensive background in reproductive and child health research and community interventions, with notable role at institutions such as the Postgraduate Institute of Medical Education and Research, United Nations Population Fund, and the World Health Organization. Dr. Iyengar has been actively involved in shaping policies and programs. As the co-founder and chief executive of Action Research and Training for Earth Society, Dr. Iyengar has led groundbreaking initiatives in contraception research. Furthermore, his expertise has been sought after in various policy guidance and review groups associated with the National Health Mission and the Ministry of Health and Family Welfare in India. With this, I invite both the speakers to share the insights from the report. Over to you, Gunjan.
Thank you, Ria. Let me share my screen. Thank you, everyone. It's my pleasure to be part of this webinar, and it's my honor to share this finding of this report with you. So the presentation is divided in two parts. So I'll cover the environmental aspect of menstrual hygiene products, and Dr. Iyengar will talk about the results and the policy implications. So the fourth National Family Health Survey for the first time inquired about menstrual hygiene products used by young women. By the way, they had not included older women. But a matter of fact, there has been increase in use of modern menstrual hygiene products among young women. And this is similar even in case of rural women. And you can see the significant increase in use of sanitary pads from 41% to 64% in NFHS 5. Several factors have contributed to this growth. So greater market penetration, aspirational brand marketing, availability of different size of sanitary pads, their packaging, and even different price ranges has also contributed to this growth. There has been promotion of sanitary pads even through film and the celebrities talking about it. Narratives in mainstream and social medias are also around adoption of sanitary pads. And of course, government initiatives have promoted use of sanitary pads by increasing the access. When we look at some key government initiatives for menstrual hygiene, so in 2011, Ministry of Health and Family Welfare launched a scheme for promotion of menstrual hygiene, under which the provision was to provide sanitary pads at a subsidized rate. The same ministry in 2014 launched Rashtriya Kishor Swasthya Karyakram, which is commonly known as RKSK, which focuses on adolescent and the provision of free sanitary pad distribution to them. Now, when we look at it from menstrual hygiene lens, the focus of these schemes have been on sanitary pads. Even when we look at the communication materials around it, they were heavily pad focused. In 2015, Ministry of Drinking Water and Sanitation issued a national guideline, which recommended that sanitary pads should be available in schools. There should be separate toilets for girls. There should be clean water supply in schools, and also disposal mechanism should be in place in schools. Now, though it talk about disposal mechanism, it has not included disposal of other products apart from sanitary pads. And then in 2019, central government launched oxo-biodegradable sanitary pads, which were made available through fair price drugstores. We also looked at some state government initiatives on menstrual hygiene management, including Jharkhand, Odisha, Sikkim, Maharashtra, Gujarat, and Tamil Nadu as well. And we found that their focus, the menstrual hygiene schemes, were mostly focusing on disposable sanitary pads. Now, let me briefly talk about what is menstrual cup. So menstrual cup is a bell-shaped device which is made up of medical grade silicone. Now, this silicone is water repellent, which means blood or soap does not stick to it and it can be washed off easily. Now it is available in 3 different sizes, small, medium, and large. And in the image, you can see, for example, for small, it's 15 ml, 22 ml, and so on. And this is as per specifications mentioned by UNFPA for menstrual cup. Now, how do you use the menstrual cup? So women have to place the menstrual cup in vagina by herself, and where it fits firmly, it creates a sealing and it collects the blood. Now, it can be worn for up to 12 hours, depending on the menstrual flow and the capacity. And women, the only thing with menstrual cup is before and after use, it has to be sterilized, and it can be used for 10 years. Now, menstrual cups have been available since 1930s, but due to limited social acceptance, only a fringe group, which is urban, well-educated, elite group, is currently. But when we looked at the internet, we found there are more than 30 menstrual cup brands available in India. In 2019, the Lancet Public Health Journal it talked about it published systematic review on menstrual cups use acceptability, and they covered 436 records that they found, of which they selected 43 studies on use of menstrual cups, which also included some studies from India as well. And they found that menstrual cup was an effective and safe menstrual hygiene option. It also talks that it creates less leakage as compared to other products. The review also talked about adoption of menstrual cup requires familiarization in the initial phase, and the peer support is required for better use. And there was high acceptability about menstrual cup as users reported continued use. And there were some efforts in India to introduce menstrual cups. So in 2019, in one panchayat of Ernakulam district in Kerala, there was free distribution of menstrual cups to women. In 2022, 2 districts in Karnataka introduced menstrual cup for adults and girls, aged 16 to 18. Later, recently in 2023, Hindustan Latex also launched 2 brands of menstrual cups in India. And apart from this, there were some studies in Gujarat and Karnataka on acceptability of menstrual cup. And they found that among the attributes that women prefer, ease of insertion and removal, ease of mobility was ranked high. Now, the disposable sanitary pad is multi-layered. So there is this top layer, which comes in contact with the body. Then there is transfer layer, which transfers the blood to the next layer, which is absorbent core, where the blood is absorbed. And then there is adhesive, which glues together all these layers. Now, some of this, looking at the composition, apart from fluff, pulp, and release paper, 49% of this disposable sanitary pad is non-biodegradable. Now, there are oxo-biodegradable sanitary pads available, and when some chemicals are added to it, and when ultraviolet radiations, in the presence of ultraviolet radiations, it undergoes oxidative reaction and further it breaks down. But the issue is it releases microplastics, and there is talk that microplastics, enter the food chain and water bodies where it remains in the ecosystem for a longer time, and then it is more harmful to the environment. Looking at the tampon, 10% of tampon is non-biodegradable, and the issue with tampon is that it is highly cost. It is very expensive and it is not advertised enough in India. We have talked about menstrual cup. So this medical grade silicone is 100% non-biodegradable, and the only thing with menstrual cup is that it maintains its integrity, and it does not break into microplastics, and it can be used for up to 10 years, and the silicone can also be recycled. Now, we were wondering how much waste would a woman generate over her lifetime with the menstrual hygiene product use, and so we decided to compare the waste generated by these 3 methods. So we assumed 30 years of menstruation for women. Now, I know some of you might say it's longer, but considering the period of pregnancies, even after delivery, there is period of amenorrhea, and women are using contraceptive these days. So some of that can also cause amenorrhea. So we have assumed 30 years, one can take more. We have also assumed 12 cycles per year. Although with 28 days cycles, it could be 13 cycles per year, but we have assumed 12. And assuming women have 5 days a cycle, so a woman would require 10 sanitary pads and or tampons per cycle. And on calculation, we found that sanitary pad use would generate 28.8 kilograms of total waste per user, of which 49% is non-biodegradable, which leads to 14 kilograms of non-biodegradable waste. In terms of tampons, so tampon creates 7.2 kilograms of total weight. And since 10% is non-biodegradable, it is 720 grams of non-biodegradable waste. The menstrual cup can be used for 10 years, but we have assumed that women might want to change it or it might get lost. So we have assumed 5 years per woman. And that leads to total and non-biodegradable waste of 60 grams. Now, what we conclude from this calculation is that use of menstrual cup would lead to 99% reduction of menstrual waste, non-biodegradable and total waste. Now, looking at some disposal mechanism of menstrual waste. So the common practices includes burning of pad, throwing pads with garbage, burying them or flushing them in toilets. Burning of sanitary pad releases dioxin and furans, which are highly toxic and carcinogenic. And the solid waste management rule of 2016 have recommended that there should be separate categorization of waste at the source level, but in reality, only 2 cities, Pune and Bangalore, have this facility. So the issue of disposal in towns and in rural areas still remain unaddressed. Now we have been working in 2 districts of southern Rajasthan, Udaipur and Rajsamand district for last 26 years. And the half of the population, we have been working with population of more than 5 lakhs and half of which is tribal. We are working with 480 villages and urban wards in this region. We have a network of 630 women whom we call community health entrepreneurs. Now their role is to educate women. They sell low-cost commodities, including contraceptives, and they refer women and accompany them to clinics if required. We then went and spoke to 61 women and asked them what do they use during their periods and how satisfied they were with the product. And what we found that majority of women were using either discarded cloth pieces or locally purchased this lal kapda, which is commonly called as lal kapda. Now, the issue with lal kapda is you have to throw it after use after 4 to 5 months, and it is very thick. So women reported difficulty in walking. They also reported a rash because of the thick cloth. And one woman have also said ki aado tedo chalno pade, which is like you have to walk in an awkward manner. And majority of women said that leakage, staining was major issue that they reported, and that led to restrictions in their mobility. So women prefer not to go anywhere. They prefer to stay at home during periods. And when they're working, and if they're working on field, say in the month of June and July, when they're expecting rain, so rain would soak right through their cloth and people would notice, oh, she's on, people would notice a period and they would say, oh, she's on her periods, which was very embarrassing for women. We also asked women about sanitary pads and they said, yes, it's good, it's effective, but how do you dispose it? Where do you throw it? So women reported that when they so their neighbors would notice that, oh, she's going somewhere with black polythene with her. So she's not going anywhere to, fetch water or do any kind of work, but to throw something, which was very, which anyone would not want people to know. And so on World Population Day, 11 July 2019, we launched Menstrual Cup in our area. We branded it as Ritu Cup, which means Ritukal, in reference to Ritukal, which means menstrual period in Sanskrit, and Ritu meaning season in Hindi. and we made it available in 3 different sizes. We also trained our community health entrepreneurs on health and social aspect of menstrual hygiene management. How do you use sanitary pads and menstrual cup? And how do you support women who are adopting menstrual cups? So the role of community health entrepreneurs was also to promote menstrual cup, and in the process they sell the product to as low as 150 per cup, and in the process they earned some margin as well. They were also selling disposable pads, and for these women, for these purchasers, we also made available telephonic services. If they have any query, they could call and their queries would be solved. And we also collected user feedback from the community. Now we introduced menstrual cup as an option without looking down on other practices. So women in our community, including these community health entrepreneurs, were free to use other menstrual products, including pads or this lal kapda if they wish. And in the process, we also promote menstrual cup. We developed some communication materials, and the major key messages that we had were, menstrual cup was a highly effective option. So it prevents from leakage, it prevents from staining. Women could do any kind of work, so there would be no restrictions on mobility. We also developed communication materials that each day of the month feels like the same, which means that other would not notice that she is on her period. So it maintains the privacy. We also have messages including, it's a cost-effective option, it's environment friendly, and it is useful even for especially for the working women. We also have video on how to use menstrual cup. I can share the link between the chat box. But internet review has shown us that there are more than 50 videos in different languages, including Bengali, Tamil, Marathi, Hindi, English, on how to use menstrual cups. So anyone could look at it and learn how to use it. And I'll hand over to Dr. Sharad.
Thank you, Gunjan. Thank you, Poonam and colleagues at Population Foundation of India for having made this webinar possible. And a very heartfelt thanks to Dr. Sowmya Swaminathan for having released the report, which encapsulates the experiences that we have had in introducing menstrual cups in Rajasthan. I'm going to be carrying on in discussing the results, the findings that we had as we introduced these cups and gathered feedback. And I'll just take a moment to share my screen. I hope you can all see a full screen now. Priya, can you confirm? Can someone confirm?
Yes, we can see the screen.
Yeah. So what we're looking at is what is the use and acceptability of menstrual cups in southern Rajasthan based on the intervention that Gunjan has just told you about. Over the years, we looked at the numbers purchased by women in the community. Now, we have reason to believe, because these cups were not given free, that women who purchased them would do it with some motivation, and the likelihood of their being used and not wasted or thrown around would be very low. And we saw an increase right through the years. There was a dip in 2020-21. We attributed to the COVID pandemic. There was a sudden drop in the cash availability, and spending 150 rupees could be a bit difficult for women in the area that we work in. It's a tribal dominated area in southern Rajasthan. We gathered feedback from women who had purchased these cups and were using them. And essentially they said that now they could go anywhere. They were not worried about staining. Very importantly, on the top right, you see this comment that using cloth, I would get a rash, and whereas the cup led to freedom from rash. And another important thing that they mentioned, these are selected quotes, is that it was very easy to clean the cup. They did not have to face the burden of washing it or drying it till they reused it. These being important to women. The other was, as Gunjan has already mentioned, the problem with throwing pads. Now, in cities, there's a lot of anonymity when we move about, and there's a lot of garbage all over. But in villages, when women step out of the house to go and throw something, there not being any particular designated place for throwing garbage, people watch, and women therefore feel that they're being surveyed. And the cup, however, allowed them to simply clean it out within their houses or in the bathroom, and they were better off that way. There were anxieties, of course. They felt that the cup may not do very well, and therefore some women have used an additional method, a pad. But then they found that the pad really wasn't necessary, and they would then solely use the cup. We carried out another very small study. We selected 60 women, which we randomized in 3 blocks that we are working. And I know this is a very small sample, but we just wanted to get an idea of how women relate to the various processes related to inserting it, removing it, cleaning it, reusing it, and so on and so forth. You can see the 8 criteria that we covered. And since about half the women are illiterate and another 25% only have done primary schooling, we used a pictorial Likert scale, made affirmative statements and asked women whether they strongly disagreed, were equivocal, agreed, or strongly agreed with our statement. And based therefore on the scores, 5 being the highest score and 1 being the lowest, we aggregated scores from 58 of the 60 women that we managed to meet. And noted that the cup did score fairly high, but the most interesting thing was that the highest score was for the convenience and ease of washing the cup. It looks like for women, at least in this area, not having to repeatedly wash something every day was important. We looked at reports from the field staff. Now, our field staff were asked to go and meet women who had purchased the cup and talk to them and find out whether they were doing well with it, they liked it or not, and also ask them what they were using. And this was between 1 and 2.5 years after they purchased a menstrual cup. Not everyone who buys a menstrual cup paying money uses it. We found that of these women who had purchased the cup, 84% had used it. We asked them whether the use was regular, and it turns out that 85% were using it over all 3 cycles that we recalled when we spoke to them, whereas others used it on and off in a patchy manner. Some of them used an additional method, 23%, whereas a large majority, 77% of women, used only menstrual cups. We feel also from our qualitative feedback that over time, women would then start using only menstrual cups. They would not have the need to use an add-on method. Now, these 784 women had 2,352 cycles, and we looked cycle by cycle as to what was covering them, what was giving menstrual protection. And we find that about 78% of the menstrual protection was attributable to the cup. In 10%, they also used another method, whereas in 67%, only the menstrual cup was being used. So this suggests that among women who have purchased a menstrual cup, the large majority, 84%, start using it, and most periods do get protected by the menstrual cup. Now, we also found that about 14% of those who had purchased it were adolescent girls. Now, this is not representative of the sample. The 784 are not representative of the community. For that, we will need a cross-sectional household survey of menstrual hygiene practices, which we have not done as yet. But we did ask the same questions from these adolescents. We found that by and large, older women in the family, most commonly their mother had asked them to try out the menstrual cup. Again, similar to the older women, 83.5% had used the cup, but 16% had continued with pads, cloth, whatever they were using. There was some hesitation. You can see this quote, "I'm scared to use the cup. Now, how do I insert such a big thing?" And conversely, there were others who said, "This has become very convenient. I don't have to struggle to go around buying pads or getting pads and using them. With this Ritu cup, I can instantly use it." So there are results with adolescents, and they seem to be linked to use by older women. We even asked women, how do you want to keep the cup? And we found that the cloth bag that we were providing was most preferred. Women simply pushed the cup in between some layers of clothes. We tried out giving them an attractive box. They didn't like it. They said this thing is very, very prominent, conspicuous. Children start asking what is there in it, and they try and open it. So sometimes, keeping a low profile cover is better. Now, as Gunjan mentioned, there were about 630 community health entrepreneurs. They were women themselves, and they were also using cloth or sanitary pads or migrating to the cup. There was no compulsion from our organization to use the menstrual cup. They merely were given cups to sell ahead along with their pads and contraceptives. But approximately 1.5 to 2 years, 3 years after we started the program, we asked them, what do you use? And this was a confidential inquiry. And to our surprise, these being representative of gentle women, we find that about 55% had actually started using the menstrual cup. Most of them used it regularly, some 80% in the last 3 cycles that we inquired about. And again, 91% used only menstrual cups. They did not even feel the need for an add-on method. So these women are more like women in the community who hear about the cup, know about it, and have a favorable view because they have undergone some training or some education. And it looks like in such a community, about half or a little more than half might start using a menstrual cup. This is a really large market share, although the experiment is very small. We were curious to know whether those who used the cup sold more or less, and the results were quite predictable. We analyzed their cup sales because we track how many cups they sell. And we found that those who are personally using menstrual cups sold about 78% more menstrual cups to others in the village. It suggests that they are able to better communicate, better convince other women. And this really reinforces the point that it needs a user, an experienced person to guide and help other women who are beginning to use the menstrual, because it's a bit difficult. It's like beginning to ride a bicycle or a two-wheeler. The initial days are a bit shaky until they get used to it. So what are the implications for policy and programs? Now, the 2 major points coming across is that the increasing use of disposable sanitary pads in India is going to lead to many metric tons of annual waste. Dr. Swaminathan mentioned. Thank you. Now, we have done an estimate for the year 2036 based on population figures. It's somewhere around up to 350,000 metric tons of waste annually. Now, the figure might be a little lower or a little higher because it is based on assumptions, but it does tell us that it's a large quantity. The second is both the global reviews that Gunjan mentioned about, the publication in the Lancet and other experiences, and Indian pilot experiences, including our own experience, suggest that if women were to have access to menstrual cups, and the initial use were mentored by some experienced user or by a guide, there would be high acceptance and satisfaction, especially for women who are transitioning directly from local options straight to the menstrual cup. This is a bit like we're moving from no telephone to the mobile phone rather than going through the landline step, some kind of leapfrogging. So we have made certain indicative key recommendations. These are by no means a complete list. We feel that, especially with government support, we should support platforms for education and access to menstrual cups among government employees or government workers who are engaged in long or outdoor working hours, like auxiliary nurse midwives, like women police personnel, Anganwadi workers, or even school teachers who have to go long distances to rural schools, because they are the ones who need protection for longer periods of time. They lack toilet access. A menstrual cup, unless a woman has heavy flow, can be kept in for 12 hours without changing if the size is correct and the flow is not extremely heavy, which luckily most women are able to deal with. The second is that there should be pilot interventions, free or subsidized access to menstrual cups like Kerala has tried out for women in marginalized communities. And this could be done through health department, could be done through women and child development, through youth and sports, because athletes benefit a lot from menstrual cups. And we could learn from that experience. For the larger mass of people, given that the millions, what we need is a larger platform, and we are suggesting social marketing. There are already social marketing experiences, and menstrual cups could be tried out, and there would be larger availability. We suggest that menstrual cups be positioned as an option for women and not only for adolescents. We therefore recommend that this kind of an intervention target women, because large numbers, millions of women don't have good menstrual hygiene options, including adolescent girls, but not exclusively adolescent girls, and rely on women in the family to address the needs of adolescents. If we keep targeting adolescents and keep the women out of it, then we don't get the women's support in getting adolescents to use menstrual hygiene options, including cups. And lastly, Dr. Sowmya Swaminathan has underscored this. We don't have global and national standards. India doesn't have national standards. There are no BIS standards. UNFPA norms are being followed. But we do therefore need government action to establish norms for manufacture of menstrual cups in India. In essence, A menstrual cup compels a woman to, become more familiar with her own body and to learn and to do more to maintain her health and well-being. However, the big advantage is that it is very effective. No one seems to come to know that a woman is on her periods, and that might reduce restrictions, taboos, and make menses a more normal process. We therefore feel that scaling up the use of menstrual cups would enhance women's health and agency, and also in the same step, help to preserve the environment. Thank you for listening. Thank you.
Thank you. Thank you so much, Dr. Sharad, and thank you, Gunjan, for sharing the much needed comprehensive evidence highlighting the community acceptance and environmental cost of various menstrual hygiene options, and especially the menstrual cups. Your insights serve as a policy case for experts and change makers in our webinar today to further strengthen our collective efforts towards sustainable menstrual hygiene practices. With this, now we move into our next session where we will hear the inspiring voices of our youth members. They will share their first-hand experiences, showcasing how community-driven approaches and innovative models are actively improving, promoting sustainable options, and dispelling myths and misconceptions. We have with us Ms. Sanya, Ms. Aarti, and Ms. Jyoti, who are youth champions and founding members of sanitary pad banks in Bihar. They have also been voluntarily associated with Population Foundation of India and are working towards improving access and utilization of adolescent sexual and reproductive health services among more than 10,000 adolescents and young people in the districts of Darbhanga and Nawara in Bihar. As a part of this initiative, they have formed adolescent groups with over 100 sanitary pad banks, since supplies weren't available at schools and were closed during COVID-19 lockdown. Some of the girls were also trained to stitch and distribute sustainable cloth pads. So apart from saving money, they have also been able to reduce the environmental impact of commercially produced sanitary pads. Today, we also have with us Ms. Meera, a Taruni Sakhi, or a community health and entrepreneur and a community mobilizer at ARTH. She will be talking about how she has been able to ensure equitable access to menstrual hygiene as a critical way of promoting dignity, equality, and being able to empower adolescents, and the need to address these issues. तो और मैं ज्यादा ना बोल के अपनी पहली स्पीकर सानिया को बुलाना चाहूंगी, और सानिया, आपको मैं माइक देती हूँ. आप प्लीज अपनी बातें हमारे साथ शेयर करें, अपने एक्सपीरियंसेस हमारे साथ शेयर करें.
थैंक यू मैम. आप सभी को मेरा नमस्ते. मैं सानिया, मैं बिहार के एक छोटे से गांव हरदिया जो नवादा जिला में आता है उसकी रहने वाली हूँ, और पॉपुलेशन फाउंडेशन ऑफ इंडिया में एक यूथ चैंपियन हूँ, और मैं 2017 से इसमें जुड़ी हुई हूँ. मैं आप सबको बताना चाहूंगी कि हमने नैपकिन बैंक की शुरुआत कैसे की थी अपने. हम लोग जैसे कि हर एक महीने हम लोग मीटिंग करते हैं एडोलसेंट के साथ. हम लोग मीटिंग कर रहे थे. 2-3 मीटिंग में हमारी एक सहेली जो दीपिका थी वो नहीं आ रही थी. जब हमने उनसे बात किया तो हमें पता चला कि उन्हें लिकोरिया का मतलब शिकायत है थोड़ा. तो इसका हम लोग जब शीला दी आई, हमारे जो दीदी आए, वो बताएं हम लोग को कि इसका एक कारण खराब कपड़े मतलब गंदे कपड़े का यूज करना भी हो सकता है. तो हम सबने सोचा क्यों ना हम लोग मिलकर एक पैड बैंक स्टार्ट करें, जिससे हमें काफी फायदे होंगे और ये हमारे लिए सुरक्षित भी है. तो गांव की लड़कियां हिचकिचाहट है, कैसे जाएंगी कैसे लाएंगी, इसलिए हम लोग सोचा कि हम लोग ग्रुप में ही अपना नैपकिन बैंक स्टार्ट कर दें, जिससे कि किसी को हिचकिचाहट भी ना हो और वो सेफली यूज भी कर सके. तो गांव की लड़कियां हैं तो उनके पास उतने पैसे नहीं हो सकते कि वो एक साथ 30 रुपए.
मुझे लगता है कि सानिया ड्रॉप हो गई है नेटवर्क के कारण. सानिया, आप हो वहां पे? हाँ सानिया, यस.
तो हम लोग जैसे एक महीने में अगर 30 दिन है तो हमारा पैड भी 30 रुपए का ही आता है. तो हम लोग हर एक दिन मतलब 1-1 रुपया जमा करने लगे, जिससे हमें हम लोग का मीटिंग होता था महीने में, उस दिन सारी लड़कियां पैसे लेके आती थी, यहाँ पे जमा कर देती थी। और हमारे ग्रुप से ही 2-3 लड़कियां मिलकर, क्योंकि हिचकिचाहट था, गांव की लड़कियां हैं, उन्हें बहुत हिचकिचाहट, वो कैसे जाएंगे, कैसे लेके आएंगे, दुकानदार के पास कैसे बोलेंगे कि हमें पैड चाहिए। तो 3-4 लड़कियां मिलकर घर से ही हम लोग पेपर वगैरह थैला लेके जाते थे कि अगर हमें दुकानदार के पास ना मिले तो कोई रास्ते में या फिर कोई देख ना ले कि हम क्या लेके आ रहे हैं, उसको ढक कर अच्छे से मतलब ढक कर लाया करते थे। और और वो हिचकिचाहट था हमारे मन में कि हम लोग कैसे लेके आएंगे पैड। और फिर तो हमारे गांव की भी और भी, और इससे हम लोग का ये फायदा भी हुआ है क्योंकि नैपकिन बैंक स्टार्ट करने से हम लोग में हिचकिचाहट।
आई थिंक सानिया आप फिर से ड्रॉप हो गई। आई थिंक सानिया आप अपना वीडियो ऑफ कर दीजिए, तब आपकी आवाज क्लियर आएगी।
ओके मैम।
हाँ,
मैम आवाज मेरी आ रही है?
हाँ अभी थोड़ी ठीक है।
तो हम लोग जाके लेके आया करते थे और फिर ग्रुप में ही बैठ के सारी लड़कियों को पैड दिया करते थे। इसी तरह से हमारा चलता रहा, जिसके साथ हमारे दुकानदार के साथ भी हम लोग का थोड़ा कांटेक्ट बढ़ गया, जिसके कारण लगे, जिसके कारण अगर 27 रुपए में दे रहे हैं तो हमें 3 रुपए एक पैड के पीछे बचत होती थी। और भी हम लोग एक्स्ट्रा पैड लाने लगे क्योंकि हमारे गांव में अभी भी कुछ ऐसी लड़कियां हैं जिनके पास खाने के पैसे नहीं है, तो वो हमें पैड के पैसे कहाँ से कि वो यूज कर पैड देने लगे। और भी हमारे गांव की जो अ, चाची है, भाभी हैं, वो जब जानी कि हम लोग पैड बैंक चला रहे हैं।
I think Sania is getting disconnected because of poor bandwidth issue. So we will try to move ahead. But precisely because her voice was also breaking, I would just like to summarize what she was sharing with us. She talked about setting up of a community-led model called the Sanitary Bank, where girls made smaller contributions and purchased sanitary napkins collectively, and they were able to use it by making smaller contributions. And
Hello,
she
ma'am.
also talked about, हाँ सानिया मैं आपके बात को समराइज कर रही हूँ क्योंकि आपकी आवाज टूट रही है। आपका बहुत बहुत धन्यवाद। मैं बस आपके बातों को 2 लाइन में बता रही हूँ सबको। Thank you so much. And then she also talked about how this group has also been able to address some of the myths and misconceptions, and especially stigma around the use of sanitary napkins in the community. तो इसके साथ अब मैं आरती आपने हमें ज्वाइन किया है क्या? आरती आप यहाँ हो? So maybe Aarti is also having some issue with the internet. Some issue has just overcome. So with this, I think Jyoti हम आपसे रिक्वेस्ट करते हैं क्योंकि दोनों को प्रॉब्लम हो रहा है इंटरनेट से कनेक्ट करने में। तो ज्योति मैं आपको इनवाइट कर रही हूँ कि आप अपने सैनिटरी क्लॉथ पैड्स के बारे में हम सबके साथ शेयर करें। ओवर टू यू।
नमस्कार मैम, मैं ज्योति कुमारी बिहार से नवादा जिला की ग्राम खरा की रहने वाली हूँ। मैं पॉपुलेशन फाउंडेशन ऑफ इंडिया की यूथ चैंपियन की तहत से काम करती हूँ और मैं इसमें 4 साल से काम कर रही हूँ 2020 से। तो जैसे सानिया ने बताया कि नैपकिन बैंक, उसी तरह से हम लोग एक अपने गांव में नैपकिन बैंक का स्टार्ट किए। पहले तो स्टार्टिंग किए, उसके बाद फिर उसमें सारी लड़कियां स्टेपरी यूज नहीं करती थी, लेकिन हम यूज किए। लेकिन इससे हमें एक बात और कहनी चाहती हूँ कि जहाँ मैं अपने गांव में बैठक करती थी वहां पे स्टेपरी तो सारी लड़कियां भी यूज करती है, पता है 2 घंटा में 3 घंटा में चेंज करती भी है। लेकिन उसको यूज करने के बाद, चेंज करने के बाद फिर सोचना पड़ता है हर एक लड़के को हम ये कहाँ पे रखे, कहाँ पे छुपा कर रखे कि फैमिली लोग देखे नहीं। और कहीं गलत जगह चल जाएगा तो जल जाएगा, तो एक होता है कि माँ ने जब बन पाएगी, ये गांव में अधिकतर लोग बोलते हैं। लेकिन स्टेपरी जो एक यूज किया जाता है, तो सबसे पहली बात है कि उसमें पैसा लगता है। हम लोग लड़कियों का स्टूडेंट लाइफ में दो पैकेट लाते हैं, एक पैकेट 30 रुपया में देता है, अगर 2 पैकेट लाते हैं हम लोग को 60 रुपया लगता है, जिसे साल में 720 रुपया हम लोग को खर्च है। तो स्टूडेंट लाइफ में हम लोग उतना नहीं दे पाते हैं। लेकिन और ये गंदगी भी बहुत ज्यादा पर्यावरण में नुकसान भी करता है। जैसे अगर हम यूज किए तो कहीं हमको फेंकना पड़ता है, कहीं पे तो कहीं डालना पड़ता है, तो उससे हमको पर्यावरण में बहुत भी नुकसान है और जगह का भी नुकसान है। जहाँ पे अगर हम फेंक रहे हैं वहाँ पे, जैसे कहीं भी 2 जगह का कमरा, मेरा वहाँ पे कमरा 2 जगह, जैसे पूरा ऑल इंडिया में यूज किया जा रहा है, तो 2 जगह का बाई चांस 2 जगह का ही कमरा भर वहाँ पर फेंका गया है, तो वहाँ वो हमको नुकसान ही नुकसान है। लेकिन अगर हम ये स्टेपरी कपड़ा का यूज करते हैं, जो हमें ट्रेनिंग में बताया गया था, हाथ से खुद से सील कर हम लोग खुद से 2 स्टेपरी हम लोग खुद से सिए थे और अभी यूज भी कर रहे हैं, और मेरी जितनी भी टीम की लड़कियां सारी यूज कर रही है। उसमें बहुत ही अच्छा है। उसमें ये है कि ये कपड़ा तो यूज करते हैं, ज्यादा ब्लीडिंग तक मतलब ज्यादा टिकाऊ भी रहता है, स्टेपरी से बहुत ही अच्छा है। और कहीं भी धोकर डाल दो सूखने के लिए, तो उसमें क्या लगता है कि रुमाल की जैसा, अगर कोई देखेंगे भी ना तो नहीं सोचेंगे कि ये क्या चीज सूखा जा रहा है। अगर एक रुमाल की तरह रहती है, बटन लगा के रस्सी में कहीं भी टांग दो सूख जाएगा, कोई भी देखेगा तो बोलेगा ये रुमाल है, कोई गलत नहीं समझेगा। तो इससे हमें ये भी फायदा हुआ मैम कि अगर हम कहीं स्टेपरी यूज कर रहे हैं तो उससे थोड़ा खुजलीपन भी होता है और जलन टाइप का भी होता है, और प्लस में पैसा भी लग रहा है। लड़कियों के लिए सोचना भी पड़ता है कि हम लोग कहाँ से लाएं गाँव में। लेकिन अगर हम कपड़ा का जो पैड यूज करते हैं, उसमें हमको कोई अगर 4 पैड रह जाएगा, कोई भी स्टूडेंट कोई भी महिला के पास, तो वो अच्छे से यूज
देखिए तो
करेगी,
मैडम,
उसमें पैसा भी
देखिए
नहीं
तो
लग पाएगा।
मैम आप देखिए तो।
हेलो हेलो।
हाँ ज्योति, आप कंटिन्यू कीजिए।
जी मैम, तो मैं यही चाहती हूँ कि ये जो हाथ से सिलकर जो स्टेपरी कपड़े का बनाने का है, वो हमें आगे से आगे लेके चले, ताकि हमारी जितनी भी गांव की महिला है वो पैड नहीं यूज भी करते हैं तो अपने से हाथ से सिलकर भी उस कपड़े में एक प्लास्टिक के जैसा डाला रहता है, जिससे हमें ब्लड सूखने का और टिकाऊ रखने का एक क्षमता रहता है, जिससे हम हर एक लड़की लोग यूज कर सकते हैं, जिससे हमें पैसा भी बचत हो रहा है और कहीं जाकर हमें लाने का भी टाइम भी बच रहा है। तो ये हम काम बहुत जल्द आगे ले जाने के लिए सोच रहे हैं। और मैं तो ये कहना चाहती हूँ कि पॉपुलेशन फाउंडेशन ऑफ इंडिया को मैं धन्यवाद देना चाहती हूँ, क्योंकि हम एक स्टूडेंट हैं, हम लड़की लोग खुद अपना बात को छुपा के रखते थे, गांव की लड़की थे, और अब क्या हुआ कि लोगों को लड़कियों के साथ में बातें करना, सभी से बातें लेना कि क्या प्रॉब्लम है, हमें किससे बात करनी है, किससे किससे शेयर करनी है, ये बात हमें जानकारी मिला है। और बहुत लोग, मेरी जितनी भी गांव की लड़कियां सभी लोग बहुत टैलेंटेड हो गई है इस पॉपुलेशन फाउंडेशन ऑफ इंडिया के तहत में। जैसे मेरी शीला मैम ने आती थी शुरू में, सब लोग को बताती थी, हमारी ग्रुप की जैसे एक होता है एकता मूला, हमारी ग्रुप भी बनी हुई है। तो इससे एक पता चला कि सब लड़कियों के पास अपने मासिक धर्म क्या होता है, क्योंकि कोई बताने नहीं चाहता, पर हम लोग खुल के बात करते हैं। स्टेपरी पैड कपड़ा जो भी बनाने का हम लोग करते हैं, ये खुल के बात करते हैं। धन्यवाद देना चाहिए।
थैंक यू ज्योति, बहुत बहुत धन्यवाद आपका। और ज्योति, थैंक यू कि आपने हाईलाइट किया सिर्फ इस बात को नहीं कि किस तरह ये कपड़े के जो पैड्स हैं ये अफोर्डेबल हैं, लेकिन ये एम्पावरिंग भी है, क्योंकि ये से औरतें और लड़कियां खुद बनाती हैं, और ये इको फ्रेंडली भी है, और ये कंट्रीब्यूट करता है फॉर अ सस्टेनेबल सोल्यूशन और एक हेल्दियर फ्यूचर, ना सिर्फ औरतों के लिए और महिलाओं के लिए, लेकिन एनवायरनमेंट के लिए भी। बहुत बहुत धन्यवाद। हमारे साथ आरती ज्वाइन कर ली है। आरती हैज बीन एबल टू जॉइन अस। तो आरती, मैं आपको बुलाना चाहूंगी और कि आप अपना एक्सपीरियंस हमारे साथ शेयर करें, और मैं रिक्वेस्ट करूंगी कि थोड़ा सा आप ब्रीफ रखें, क्योंकि आपकी सहेली ने प्लान के बारे में ऑलरेडी बता दिया है, तो आप थोड़ा उसमें आपको और क्या शेयर करना है। आप प्लीज शेयर कर लीजिए कि किस तरह से जो भ्रांतियां मिसकंसेप्शंस है वो आप लोगों ने मिलके दूर कर पाया था। आरती, आपको मैं
थैंक यू मैम। तो मैं हूँ आरती कुमारी, बिहार के दरभंगा जिला से बहेरी प्रखंड के जोरजा पंचायत के मखनाहा गांव की निवासी। जैसे कि सानिया ने बताया कि किस तरह उन लोगों का ग्रुप चल रहा था, उसी तरह मेरा भी ग्रुप चल रहा था। लेकिन अचानक से लॉकडाउन लग गई तो दुकानें सारी ठप हो गई, बंद हो गई और पैड भी नहीं मिल पाते थे। तो हम लोगों ने बहुत कोशिश के बाद एक दुकानदार से 50 पैड मंगवाए और लड़कियों को अपना कॉन्टेक्ट नंबर दे दिया ताकि जब भी उसे जरूरत हो वो हमें कॉल कर सके। लेकिन बहुत दुखद बात थी, 1 महीने में सिर्फ 6 या 5 लड़कियां ही कॉल कर पाती थी। वो भी अगर उनके घर जाते थे तो कई सारी बातें सुनने को मिलती थी कि कहाँ से आई है, मेरे घर मत आओ, कोरोना काल चल रहा है। ये बात भी सही थी। तो हम लोगों ने अपनी सुरक्षा को ध्यान में रखते हुए एक मतलब बॉक्स रेडी किया जिसको बैंक का नाम दिया। उसमें कुछ पैड रख दिए, साथ में पेन और कॉपी रख दिए। इसके साथ ही एक बता दिया गया कि आप लोगों को जरूरत हो तो खुद ले सकते हैं। उसको थोड़ा आकर्षित बनाने के लिए उस पर कुछ पेंटिंग्स कर दिए गए ताकि वो लोगों को अपनी तरफ आकर्षित करे। ये बहुत अच्छा चल रहा था। उसको हम लोगों ने जीविका दीदी के घर शिफ्ट किया था बीच गांव में। लेकिन कुछ दिनों बाद मतलब कुछ लड़के उस पर कुछ लिख दिए जिससे लड़कियां नहीं ले पाती थी, बोलती थी नहीं इस पे कुछ लिखा हुआ था। एक दिन हम खुद जाके चेक किए तो देखिए सच में लिखा हुआ था। फिर उसको हम लोगों ने अपने घर शिफ्ट किया। तो इस मतलब एक घटना से हमको एक प्रेरित मिला कि 16 लड़कियां, आचरण किशोरी समूह की लड़कियां एक वेंडिंग मशीन लाने की तैयारी कर रहे थे। जो ऑटोमेटिक वेंडिंग मशीन होती है वो किसी कारणवश हम लोग का वो अभी तक नहीं हो पाया है, लेकिन जो बॉक्स हम लोगों ने रेडी किया था वो अभी भी चल रहा है और काफी अच्छा मुनाफा हुआ हम लोगों को। जैसे कि सानिया ने बताई थी कि 30 रुपए का मिलता है, एक अगर स्टॉक में लिया जाए तो हम लोगों को थोड़ा कम रेट में मिल पाता है। तो जिससे हम लोगों ने कुछ डिस्पोजल पैक देना शुरू कर दिया ताकि वो कहीं भी डिस्पोज ना करे और उसे पैकेट में ही डिस्पोज करे। ये भी बहुत अच्छा चला। हाल ही कुछ दिनों पहले हम लोगों का जो विश्व मासिक स्वच्छता दिवस था, उन दिनों में हम लोगों ने घुमंतु समुदाय जो अपना घर घूम घूम के रखते हैं, अब फिर 1 महीना यहाँ है तो 4 महीने वहाँ है, उन समुदाय के कुछ लड़कियों को हम लोगों ने अपने ग्रुप में ऐड किया और उस मासिक धर्म दिवस को खास बनाने के लिए कई सारी रैली निकाली गई और साथ ही साथ और रैली के साथ साथ रंगोली, चित्रकला और मतलब और जो होता है मासिक धर्म पे क्या चर्चाएं होती है, क्या भ्रांतियां होती है और उसको कैसे मिटाया जा सकता है, इस पे हम लोगों ने बहुत ही डीपली जो है चर्चा की थी। इसमें तकरीबन गांव की 40 से 50 महिलाओं और लड़कियों ने भाग लिया था। ये बहुत ही अच्छा था। और जब हम लोगों ने गांव में इसको लेके गए तो पता चला कि हाँ ये बहुत ही अच्छा चीज है। और हम लोग कहते हैं पहले उसको इस पे कुछ एक मुद्दा आया था कि अगर लाल चूड़ी, लाल सिंदूर अगर महिलाओं की क्या कहते हैं निशानी होती है श्रृंगार की, वैसे लाल बूंद हर माँ बनने की निशानी होती है। इस पे मतलब बहुत ही अच्छा इफेक्ट पड़ा था। गांव में इसकी बहुत चर्चा हुई थी, कितना सुंदर लाइन था, एक माँ बनने की निशानी है ये लाल बूंद, बहुत ही अच्छा था। और साथ में हम लोगों को इसमें थोड़ा सा जीविका दीदी ने भी साथ दिया था जो कोरोना टाइम था उसमें, और थोड़ी आशा दीदी ने भी साथ दी थी क्योंकि उस टाइम था कि हम लोग बाहर जाते थे तो पुलिस रोकती थी। अगर एक दिन हम लोग आशा दीदी के साथ गए तो हम लोगों को नहीं रोका और हम लोगों ने 50 पैकेट जो है पैड ले लिया। बहुत ही अच्छा लगा कि एक साथ हम लोगों ने आशा दीदी को ले गए तो पुलिस ने हम लोगों को नहीं रोका और हम लोगों ने 50 पैकेट ले लिए। और पहले से लड़की पैड का इस्तेमाल करती थी और अब तक 40 से 50 लड़कियों 1 महीने में आ जाती है मेरे पास लेने के लिए, और वो रात को भी आती है लेने के लिए। तकरीबन 10:30 बजे 11 बजे तक लड़कियां भी आती है मेरे पास पैड लेने के लिए। और मैं 24 घंटे सर्विस में रहती हूँ और मेरे पास हर समय अगर बोले तो 50 से ज्यादा उपलब्ध रहते हैं 24 घंटे, जिसको जब जरूरी हो तब आके ले सकते हैं मेरे।
थैंक यू आरती, थैंक यू सो मच। आपने शेयर किया कि किस तरह आप मिथ्स और मिसकंसेप्शंस को ना ही दूर कर रहे हैं, लेकिन कोविड जैसे पैंडेमिक के दौरान जब सबसे पहले जो ये आवश्यक चीजें होती हैं महिलाओं और लड़कियों के लिए, इस पे सबसे पहले चैलेंज पड़ता है। और किस तरह आप इस दौरान इनकी इस नीड को पूरी कर सकी और इस इनोवेटिव अप्रोच से हमें यही सीखने को मिल रहा है कि ऐसे क्राइसिस के दौरान हमारे नीड्स और ये ऐसे नीड्स नेग्लेक्ट होते हैं, लेकिन आपका मॉडल ये भी बोलता है कि किस तरह फ्यूचर में भी अगर कोई ऐसे इमरजेंसी सिचुएशंस आए या इमरजेंसीज हो, तो हम किस तरह से एक रेजिलिएंट सोल्यूशन बिल्ड कर पाएंगे ताकि ये कंटिन्यू सर्विस हमारे समुदाय तक पहुंचते रहे। बहुत बहुत धन्यवाद। अब मैं मीरा जी को बुलाऊंगी कि वो अपना एक्सपीरियंस शेयर करे विद मेंस्ट्रुअल कप्स, उनका कैसा जर्नी रहा है समुदाय के साथ और किस तरह से एक इनोवेटिव माध्यम के थ्रू वो मेंस्ट्रुअल हाइजीन सोल्यूशन ला सकी हैं अपने गांव में, अपने समुदाय में। मीरा जी, आपको रिक्वेस्ट करती हूँ कि आप शेयर करें।
नमस्ते, मेरा नाम मीरा गमिती है और मैं थोड़ा सा महामारी कप के बारे में थोड़ा सा मेरा अनुभव बताना चाहती हूँ कि जब पहली बार मेरी महामारी आई थी उस समय में कपड़ा यूज करती थी, तो कपड़ा यूज करती थी पर ऐसा लगता है कि सुखाने में या धोने में ये दिक्कत है। तो पर करे क्या, अगर महामारी तो आती है हर टाइम। फिर धीरे धीरे पैड के बारे में पता सुना, मुझे पता लगा तो मेरी सहेली ने पैड के बारे में सिखाया कि ये यूज करना। पर पैड भी अच्छा है, कहीं धोना नहीं पड़ता है, लेकिन ये भी था कि फेंकने में थोड़ी दिक्कत थी, कहाँ फेंके, कोई देख लेगा या खुले में कहीं रखते हैं, तो थोड़ा ये भी था। तो पैड के बारे में ये था और धीरे धीरे हमारी संस्था वालों ने महामारी कप के बारे में बताया और हमें दिखाया। तो महामारी कप के बारे में दिखाया, पर दिखने में कप ऐसा है महामारी जो मतलब देखते ही मेरे मन में कई तरह के सवाल आए कि महामारी कप हम कैसे यूज करेंगे और कैसे लगाएंगे, जो ये अंदर रहने वाली चीज है तो हम कैसे लगाएंगे, ये कई तरह के सवाल थे मेरे मन में। पर मैंने खुद ने खरीदा और खरीद के ले जाके मैंने घर पे रख दिया, मैंने यूज भी नहीं किया। और फिर धीरे धीरे मेरी ट्रेनिंग हुई थी ऋतु कप की। तो ट्रेनिंग हुई और ट्रेनिंग होने के बाद में मैंने घर महामारी आई मेरी, तो मैंने यूज किया तो मैं लगा के सुबह में फील्ड में गई और फील्ड में पूरा दिन मुझे टेंशन था कि वो ऐसी चीज है कि अंदर कहीं घूम जाएगी तो मैं किसी को दिखाने लायक नहीं हूँ, कैसे निकालूंगी, कई तरह का मेरे मन में सवाल था। पर मैं पूरा दिन काम करके वापस आई घर और आके मैंने निकाला तो आसानी से वो निकल गया और कहीं मतलब दाग धब्बा भी नहीं लगा और आराम से मैंने निकाला और धो के तुरंत वापस लगाया। तो मुझे बहुत अच्छा लगा और अच्छा लगा मुझे। फिर मैंने महिलाओं को बताया कि ये एक महामारी कप है और अपन पीरियड के समय अपन ये यूज करेंगे। तो जो मेरे मन में डर था, सवाल था, वही महिलाओं के मन में सवाल और डर था। तो फिर जो महिला को बार बार हमने समझाने की कोशिश करी कि ये अच्छा है और मैंने खुद ने यूज किया है, तो फिर महिला यूज किया, किसी किसी ने यूज किया और किसी किसी ने ले जाके घर पे रख दिया, यूज भी नहीं किया। बार बार हमने उनको समझाने की कोशिश करी और बार बार उनको समझाया, फिर जाके महिला किसी किसी ने यूज किया तो महिलाओं को वापस हमने पूछा कैसा लगा आपको महामारी कप, उन्होंने बताया बहुत अच्छा लगा है, का लगाने बाद कहीं दाग धब्बा नहीं लगता है, आसानी से अपन कहीं जा सकते आ सकते, कोई दिक्कत वाली बात नहीं, ऐसा महिलाओं ने बोला। फिर महिलाओं को समझाने का काम करती है। अभी जो महिला बहुत यूज कर रही है हमारे हमारे गांव में, हमारे फील्ड में बहुत सारी महिला यूज कर रही है और बहुत अच्छा है। और मैं खुद यूज कर रही हूँ, मुझे ये 2 साल हो गए जो मैं खाली महामारी कप ही यूज करती हूँ और मुझे बहुत अच्छा लगा महामारी कप।
थैंक यू सो मच मीरा, आपने शेयर किया। सिर्फ यही नहीं कि एक ऑप्शन जो कि एनवायरमेंटल फ्रेंडली है उसको हम इंट्रोड्यूस करें, लेकिन इस बात पे भी आपने जोर डाला कि सिर्फ ऑप्शंस नहीं, लेकिन उसके साथ साथ अवेयरनेस और जो एसेंशियल इंफॉर्मेशन है वो भी देना काफी जरूरी है। At this point we are running a little over time, and also I understand and I am sure that these are very interesting discussions and deliberations that are happening. where we are listening to great evidence and also insights from the field. So I would just thank you everybody for being in the webinar, and also requesting ki please also provide some more time. We are running a little bit late, but please stay on, and after this we would have insights from Ms. Bhattacharya and then a Q&A session. So requesting everybody to stay a little longer with us. With that, thank you, and I'm delighted to invite our next speaker, Ms. Bhattacharya. Ms. Bhattacharya is a senior government officer in West Bengal, currently serving as the Special Secretary of the Panchayat and Rural Development Department. She's got an extensive background in policy development and has held key positions as the Additional Chief Executive Officer of the West Bengal State Rural Livelihood Mission and Joint Secretary in the Department of Fisheries. Her expertise lies in non-conventional conversationalism, with which she has driven the development of several self-help groups in the Rural Development Department. Over the past 5 years, she has been actively involved in capacity building of health for the PRI officials and members. Currently, she's also an editor of the Panchayat Raj magazine. Ma'am, may I request you to deliver and share some special comments on the role that PRI can play in promoting sustainable menstrual hygiene?
Thank you, Ria. I'm really grateful to Population Foundation of India to have been invited here. I was listening to all of you, all of the invitees, and before celebrating something for PRI and all, actually, may I raise a few issues, if you don't mind, about this adolescent, about this. Am I audible?
Yes, ma'am, you're audible, but yes, you're audible, but your voice is a little low. If you could speak a little.
Not very clear. If you could speak up a little bit.
Yes. Let me try. Actually, I am in such a place. What I wanted to say that while you were, most of you were deliberating, like Dr. Swaminathan and later on Dr. Iyengar, I was trying to get a few points from them about this adolescent health. Was there any kind of problem with the adolescents? I mean, especially the stigma about the insertion of the cup inside the vagina. Was there any kind of social problem as such? That was my first question. And about the standard of manufacturing, like as was Dr. Iyengar was referring to, there should be, before the PRIs are mobilized, and because PRI has to take a great role in order to mobilize the community and bring a change in the social behavior, they have to be convinced about a particular product, that it is a standard product, because there are 30 products, 30 companies who are now branding, as you said. So there has to be some kind of acceptability as far as the standardization of the manufacturing companies are concerned. So that was my third issue. And about this shop, actually, where from they would be buying, I mean, availability of the cup itself. How could they access it? There might not be that much of sophisticated, medicine shop in all the villages, or even in all the gram panchayats for that matter. So, there might be, they have to be available in such a way that all gram panchayat women can avail them. So what I believe that panchayats can do is, they have to, first of all, they have to be convinced themselves about this environment friendliness of this cup, and women's easy acceptance. They can easily move, and their health is okay, everything like that. They have to be, most of the male panchayat members also, like the women ones, they have to be convinced about this cup. And especially with the RBSK, as you were mentioning, Ria, that in the RBSK, mm, and some of you who are mentioning the community health entrepreneurs who are trying to mobilize the women and who are trying to sell even some products among the community and among the adolescent girls. Actually, there are a category of frontline workers like VHSNC, as we know, Village Health, Sanitation and Nutrition Committee. In fact, in each of the Gram Panchayats of India, this VHSNC could be mobilized, consisting of ASHA, names, Anganwadi work, and the people and as such. First of all, they have to be convinced about the efficacy of the thing, and later on, they have to take the cue for mobilizing and all. Thank you. Thank you so much.
Thank you so much, ma'am, for highlighting how PRIs can effectively contribute through awareness and education, infrastructure development, and capacity building, and also by supporting local production and distribution. By actively engaging in these areas, PRIs can actually drive a positive change and create an enabling environment for menstrual health and hygiene. Thank you so much. With this, I can see that there are a lot of questions in the Q&A box and also in the chat. And therefore, I would request Dr. Sharad to open the floor for the question and answers from the participants. Dr. Sharad, over to you.
Thank you, Ria. There is quite a range of questions, many of them about the menstrual cup. I have been noting them down. There are, I think, a couple of the participants also wish to have raised their hands. They wish to participate. My suggestion is we first look at the questions that have been listed, answer those, because maybe they'll cover some of the questions that participants ask. There is a question on does the silicone menstrual cup produce an allergy because it remains in the vagina for as long as 12 hours in contact with the vaginal wall? The answer is that silicone, especially the medical grade silicone, is a very inert product. It does not in any way leak or leach. The molecules don't come out, and therefore it is known not to provoke an allergy. The other thing about, there's also a question on infection. The menstrual cup does not change the vaginal pH, the acidity or alkaline nature. Actually, vaginal pH is acid, and that prevents the growth of bacteria. It does not also change the bacteria which are present in the vagina normally. And it is interference in that normally predisposes to infection. The cup does not produce a change and therefore has far less chance of producing an infection. There was a question on toxic shock syndrome. Now, this was known in a few cases of tampon use. Throughout the literature in various countries using the menstrual cup, there are only 4 cases of infection with staphylococci, which is known to be the agent that toxic shock syndrome is accompanied by. It could not be attributed to the menstrual cup, and therefore today it is considered that the number of cases are just too few, too occasional in the literature to deserve this caution. However, what is mentioned is that menstrual cups cannot be left inside and forgotten. If that happens, then the chance of a local infection increases. So menstrual cups are currently, as per standard recommendations, not associated with toxic shock syndrome. The number of cases is just too few. One question was there a backlash from men? This question has been asked 2 times. So, in our experience, we are working with the women. There has been no adverse reaction from the men, any overt reaction. We have not gone around asking the men about it. Men tend to leave this matter to the women and don't interfere. There is, however, one caveat. If a woman has fitted the menstrual cup, then she can't have sex with the cup inside. The cup has to be removed. And that is something that is part of standard instructions when the cup is being provided. So there was Ms. Bhattacharya had asked, do you find it in shops and elsewhere? The short answer is no. Even in Udaipur, barring some 1 or 2 shops, retail chemists are not selling menstrual cups. They're only available online. And this seems to be a demand issue. There isn't demand, and so there isn't supplies. Some years ago, I even spoke to some gynecologist colleagues and they were not very clear about what the menstrual cup is and how it is used. They were not very familiar with the use. So we clearly need a high level of awareness. Any social problems with the use of adolescents inserting it? And there's one question is, how do we go around introducing it among girls? Now, I wish to emphasize that it's not that the older women have solved their menstrual hygiene problem. And I think it is high time we start looking at menstrual hygiene as an issue for women at large and not only adolescents. If there's a question from Chennai about low resource community, how do we convince the girls to use it? My answer is, please talk to the women, including the girls, and see that women's needs are met. Now, if we try and go around giving menstrual cups to the girls, but keep the women out of it, they're going to wonder what's going on and what is this thing being put inside. So in most cases, we found that women who used the cup themselves or were familiar with the use were very open about their daughters or nieces using the menstrual cup. So I think the issue is with us. We keep, looking only at adolescents as deserving menstrual hygiene interventions and not women at large. Maybe we think that the numbers are too large, but that's a fact of life. All women need menstrual protection, as Vanita is mentioning in the chat box. Let's stop looking at menstrual hygiene as purely an issue of adolescents, even if we are working with adolescents. Adolescents have several other health needs and several other facets in a very critical phase of their lives. But it's high time we start looking at menstrual hygiene as an issue for women. And we feel that if menstrual cups, especially, there is an experience or an older woman, the girls will also start using it. That's not to say that you don't make girls aware of it, but keeping the older women out is not a very good strategy. Cost of the cup in our area, we've been giving it for 150 rupees. And now remember that the person selling it is making a margin of almost 50 rupees. If you write to suppliers, they write back, they offer a price. Now, our organization does not recover marketing, design, promotion, management costs, and that's why it is so cheap. We are non-profit. We make no money out of this. As a matter of fact, we spend money. In commercial terms, we run at a loss, but that's what NGOs are supposed to do. So those who you get it in the market for prices from 250 to about 1,000 rupees, their cost of marketing, advertising, promotion, packaging, delivery, and so on and so forth is recovered, including, I suppose, a profit margin. Ms. Bhattacharya, you're also asking about hymen snapping. I mean, we found that, first of all, there isn't a standard size of hymen. Hymens also are loose or they are not so loose depending on certain physiology and also the activities by these girls. Inserting a menstrual cup is in no way equivalent to having sex. And I think we should stay with that argument. We should not subscribe to or play into the hands of conservatives who think that a girl's body has to be preserved for someone. Now, who is the best person to take that decision? My suggestion is it is the women of the house, the mothers or the aunts can take that call, which goes back to the earlier point that I made about engaging with women and not only with adolescents. Other questions, how do we promote among girls? I think we've looked at. Can the report be shared with others? By all means, it is now a published report released by Dr. Swaminathan. Social problems. Yes, Anganwadi workers and Ashas, could they provide it? Well, currently the government believes in free provision of sanitary pads and even contraceptives. Tomorrow, if the government has a scheme whereby they make a margin, maybe they'll be more motivated, but that's a policy decision that the government has to take. We have not had to deal with government workers. Our community health entrepreneurs are not government appointees. They are freestanding women in the community. Any further questions that I may have missed? And Ria, maybe those who want to speak could.
Yes. So I think all the questions in the box have been addressed. Is there anybody who would like to say anything or share a comment? Or we would close for now. However, we are open to more questions and comments. Please feel free to share it with Population Foundation of India and ARTH, and we would get back to you if some of the queries or questions have not been answered. And if there are also certain questions and clarifications or insights and comments you would like to share after going through the detailed report, So we welcome that from all participants. With this, I would really like to thank everybody and extend my heartfelt thanks to all the participants and esteemed speakers for their invaluable contribution to this webinar. Thank you so much for also staying beyond time. And at one point of the webinar, we had more than 160 participants. So thank you so much for that participation. And the insights from our esteemed speakers and the discussions on menstrual hygiene and sustainability, along with the community-led interventions, will definitely inspire and equip champions and change makers present here today and also beyond to advance actions in these areas. Together, we can ensure equitable access and reduce the harmful impact on the environment. Thank you all for joining us today. Thank you so much.
Very